Hello and welcome to my channel. This is Dr. Rizwhan Suleman of the ICAHT Center of Integrative Medicine. Now, I was asked a strange question recently, and that question was, can you die from knee arthritis? Now, it might be a bit of a strange question. You might think, well, how could you die from knee arthritis? And to be honest, I thought the same. When I got that question in the beginning, I thought, well, my immediate answer was no. But then I thought about it, and I actually thought about a lot of cases and patients that I have. And I thought, hang on a sec, if you really understand the problem, let's understand knee arthritis itself, right? So there's different types of arthritis, and what we're going to be talking about here is osteoarthritis. Now, you find that there's a lot of people out there who have a lot of degeneration in their knees, and they get knee pain, and they go to the doctors, and the doctors tell them that, look, we've had a look at your imaging, we've had a look at your x-rays, and you've got a lot of degenerative changes happening in your knee, the cartilage is all worn away, and you've got bone on bone and they're rubbing together, and this is the reason why you're getting all your pain. Now, this problem itself, and I can't really go into the details and the intricacies of exactly why or how you develop it at the moment, because this video is not going to be doing it justice, but there's tracking issues, and there's weight-bearing issues, and there's lots of different things that could potentially be contributing to that degeneration happening early. However, going back to the question, can arthritis of the knee lead to death? My answer actually is yes, I believe it can lead to death. And I have seen patients, and I have seen instances where knee arthritis has led to really serious comorbidities and really serious and life-threatening health problems. Now, first of all, the problem itself can be very painful, and if any of you have ever suffered with knee pain in general, you can understand that it can be, quite a nagging, quite a horrible thing to be going through, especially if every time you move you feel pain. But in addition to that, when you are having knee pain and you're having osteoarthritis, that's happening all the time, right? So imagine having, if you've ever hurt your knee or knocked your knee and you've been in pain for a little while, imagine having that all the time. Now, for those of you out there who are listening to this because you do suffer with knee arthritis, now, for a lot of you, you may be managing your problems using pain medication, you may be using non-steroidal anti-inflammatories, and these medications themselves, and recent papers and recent literature has shown that these actually increase your chances of cardiovascular disease and heart attack. So if you're already prone to these sorts of problems, then your chances of having them are raised as a result of that. So this would be an indirect effect of the knee arthritis. So number one, the medication that you're taking can lead to serious problems, especially if you're using them in the long term, because you shouldn't be using these medications in the long term. They should be for pain management in the short term, and if you're taking them in the long term, it's an improper use of them. And if you have been prescribed them for the long term and you're constantly on a repeat prescription for them, then I think you should speak to your GP or your doctor about that, because that's not how it should be. Having long-term non-steroidal anti-inflammatory medication will result in you having stomach problems with your stomach lining, with your digestive tract, and can also lead to problems with the digestive barriers, which has a big impact on your immune system. So again, having another knock-on effect that this problem can lead to other issues as a result of the medications that you'll be taking as a result. Now, moving on from there, when you are in pain and when you have arthritic knees, and we're talking about when the knee can often get, you can have flare-ups where they swell up, you can have crunching sounds, and you can have a lot of, pain and inflammation around the knee. Now, obviously, when you're in that state, you're you're much less likely to be involved in exercise and activities. Now, if you are in that situation, it's not very difficult to end up putting on, and be someone who puts on weight as a result of this problem. And I see a lot of patients who are in a catch-22. I saw 2 patients today who were in this exact same situation. They were asking me, how is it that I can lose weight when I have arthritic knee pain like this and I'm in so much pain? How can I lose weight? Because the doctors are telling me that I need to lose weight so I'm not putting as much pressure on my knees, yet I can't lose weight because I am in pain. Now, I'm not negating the fact that you're in pain, and people in this situation are in a predicament. It's not an easy thing to deal with, but there are ways out of it. Number one, you could try doing exercises which are not weight bearing, such as swimming. And another thing, obviously, is diet control. All right, now you can lose weight and you can manage this problem without having to do so much exercise. Weight loss and this kind of area of nutrition is a really big aspect of weight loss. Sorry, nutrition is a really big aspect of weight loss. And if you're able to take control of your nutrition, even if you're not doing as much exercise, especially weight-bearing exercise on your legs, then this can really help you reduce that weight. Now, I've also had situations where I have patients who are coming in to see me who are suffering with lower back pain as well as knee pain, and there is a very, very close connection. So if you suffer with osteoarthritic knees, I want you to first of all open your mind. Don't just think that, okay, this is a natural process, I'm getting old. If it is the case, then why aren't you having osteoarthritis throughout your whole body? If it's wear and tear, why is it just your knees which are wearing and tearing? Okay, so why is it that you're having that in that way? Now, the question needs to be asked, what is it that's causing this imbalance, and why am I feeling this, and why am I getting the degeneration in my knees and not in my hips, or not in my ankles? Why is it happening in my knees? Now, just in the same way where a car may have a tracking issue and you have imbalanced wear of the tires, or just in the same way that you can have imbalanced wear on anything, whether it be a piece of equipment or whether it be your body. This is a result of imbalance. It's not a result of the natural progression. You can have two cars, one which is being taken care of and has had all the mechanical checks and it's been well balanced and well maintained. It can be really old and it can be in a good state, and you can have a car which is not very old and is not being looked after and it's in a very bad state. So I would say that this isn't a natural progression of and just something that comes with age. This is something which comes as a result of imbalance and less than ideal maintenance. Okay, so this is the other point. Now, moving on to the situation I've had with my patients, specifically what I had today, where my patient said to me, my doctors have said that my knees need to be replaced. Okay, so looking at knee surgery. So this is a complete knee replacement. And they're saying, she said that I've seen two doctors. One doctor has told me that I can't have my knee replaced until I lose weight. Okay, and she said, well, how can I lose weight? Because I'm in pain and agony and so forth. Now, with this particular patient, she had quite a complex history, and she had quite a complex social situation, to be honest, as well. She's a single mother, and she wasn't extremely young. I think she was in her 50s, and she has two adult dependents. So she has two children, or I would say dependents, or two of her children are disabled, right? So she's now in a situation where she's like, okay, I need to get my knees sorted, because if I don't, and I'm not able to look after my sons, who's going to look after them? Her sons both of them have cerebral palsy and had learning difficulties, right? So she's got a lot of pressure on her to look after her sons. And she was saying to me, look, if I don't get my knees sorted, then I'm worried that I'm going to be, I'm not going to be able to look after my sons. And this was something which was really getting her upset. Now, in this particular case, like I said, she was given the option of, she was given the option of surgery, but she said she can only have it if she loses weight. Now, went to see another doctor, another surgeon, and that surgeon said, I'm willing to do the surgery at your own risk. Okay. Now, that's a very, very important kind of sentence at the end of that, a very important statement at the end of that, at your own risk. Now, she asked me, what does that mean? And I explained to her that obviously, if you're having surgery where you're still quite heavy, the recovery rate is not going to be the same as having surgery when you're light on your feet and you don't have as much weight going through. Now, this is a really important factor. And I want people I want people who have osteoarthritis to understand something, and that is that having the surgery on its own is not the solution, okay, to your problem. Because I have seen people who have had knee surgery and they're worse after the surgery. Now, if any of you are watching this and you're considering having a knee replacement or having knee surgery, then you will I'm sure you must have come across cases and you're looking into it and you're seeing, well, how come some people come out worse off? How come some people, they're in, agony before and they're in agony after? How come some people before they were, and I've seen this. I've seen people who have gone in for the surgery. Before they went in, they were in pain. When they come out of the surgery, they're in pain. But not only are they in pain after the surgery, but they're not able to move their knee anymore. So the functionality of the leg also reduces. Now, why does this happen? This happens because the appropriate aftercare is not given to the patients. Now, when I say aftercare, I mean the appropriate rehabilitation. The muscles around the knee need to be really worked on and really kind of rehabbed back into action. You can't just have a knee surgery and think that that's the end of it. And unfortunately, especially here in the UK, I don't believe that the NHS and the normal systems of healthcare here are providing the appropriate support that patients need. I see people coming here maybe 12 months after a knee replacement, and they tell me that they only had 6 sessions of rehab after their surgery, or they had limited rehab or physiotherapy that just told them to do exercises. Now, there are much better ways of dealing with this. Now, in our centers, we use a wide range of techniques, not just to help people who have had surgery, but also to help people who are kind of trying conservative measures. So we can use cupping therapy, and wet cupping therapy is a really, really effective way of helping and managing arthritic knees. But the cure for it and the way to actually resolve it is by correcting the mechanics, okay? And this is something which I can't reiterate enough. And if you are someone who's suffering with knee pain, or you're suffering with knee arthritis, and you're looking at kind of arthroscopies, and you're looking at kind of knee surgeries and knee replacements, or having repeated corticosteroid injections, then I would really recommend that you look into knee mechanics and how that can affect your knee function. And go and see a professional, go and see someone who can do a biomechanical assessment for you to assess the integrity of the knee joint and the integrity of the muscles around the knee. Because remember, when you have arthritic pain, 80% of the pain is coming in according to the literature, 80% of the pain comes from the soft tissues around. And it makes sense as well, right? Because the pain generating structures or the structures which have the most nerve endings around the knee joint and around that area are not the bones, are not the cartilage, because they're relatively inert. They don't have that many nerve endings. So their ability to feel pain is reduced. They don't have that much capacity for it. So, just on the probability of it, the soft tissues around it are much more likely to be factors that generate pain. And the literature indicates the same. When you look into musculoskeletal medicine and you look into pain journals and you look into these aspects, especially when it comes to arthritic pain and musculoskeletal pain, you'll find that the soft tissues are what causing a lot of the problem. Now, those of you who are considering I've seen a letter recently as well from another one of my patients who had a letter from their doctor saying, look, we've seen your x-rays and we've seen your MRIs, and you do have degenerative changes. We've tried you on, conservative management, and that hasn't helped. Now, conservative management in this context was just a very short handful of physiotherapy sessions, which were not hands-on. They weren't being done onto the muscles, but just the patient was asked to raise their leg and bend their leg and raise their leg and bend their leg, and that was it. In my opinion, that's not physiotherapy. I think there's a lot more that should and could be done for patients in this state. This patient was told that you've tried conservative measures, and those conservative measures were corticosteroid injections and the limited physiotherapy that they were offered. Now, corticosteroid injections, now you might find that they help you, and you might find that they relieve your pain for a short amount of time, but they are painkillers. They don't fix the problem. It's like driving your car, and if you have the light flashing saying that there's a problem with your car, and then you find that you just break the light and then, the problem's sorted. You think, yeah, I'm fine, and you just carry on driving. The reality is sooner or later, you're going to come across that problem and it's going to resurface. And the same thing goes with corticosteroid injections for arthritic problems and for mechanical dysfunction. It's not a long-term fix. And what you'll usually find is the pain and symptoms will come back after a given time period. And unfortunately, one of the side effects of corticosteroid injections is that they can reduce the integrity and the strength of the collagen fibers and the tissues in the joint. So your joint actually becomes weaker and more likely to incur injury after. But anyway, I'm going to try and keep this video nice and short. I hope that was informative. So for those of you who are suffering with osteoarthritis and are looking at potential options such as knee surgery and knee replacements, please do comment. I'd love to hear from you. I'd like to make this channel a little bit more interactive and get you giving me kind of things to work on. So my content, I want to be driven by you. I'm ready and willing to answer your questions. So please do fire away. And for those of you who are watching on YouTube, please do subscribe to the channel. We will be putting a lot of content now on a regular basis. So whether you're a practitioner who wants to learn more about just different ways of managing things, whether you're a patient who's suffering with problems, or whether you're someone who's just genuinely interested in health and well-being, and you want to understand these things, because ultimately, our health is our own responsibility. We should never say, oh, I had this problem, I had that problem because the doctors didn't do this, or because the doctors told me this and I found out too late. And, working in clinical practice, I've been in clinical practice now for almost 11 years. And, the number of times I hear that I wish I knew this earlier, or wish I had this, understanding before. I hate it when I hear that, because I feel that so many people are missing out on the potential treatment options that are out there. And this is why what we offer in our center is integrative medicine. For those of you who are based in Leicester or the surrounding areas, our clinic is based in Leicester, and what we practice is integrative medicine. But there's chiropractors out there, there's osteopaths out there, there's other practitioners out there who I'm sure can help you. So go and find a specialist to take a look at your biomechanics, assess you, and keep searching. My message to you today is keep searching. You will find something that will help you. Don't give up hope. There's always a way, and just consider your options. Don't just consider that surgery is the answer and that's it. Consider your options, and even if you do go for surgery, you want to maximize your chances of recovery by ensuring that you do everything you can to help yourself recover and rehabilitate. And if that means having other treatments alongside the surgery, so after the surgery you can have different techniques, be they soft tissue techniques, be they massage, be they deep tissue techniques, be they rehabilitation, cupping, acupuncture, chiropractic, whatever it is, there's things out there that you can seek to help your problem. So I hope you benefited from that video, and please do subscribe and like our video below. If there's anyone who would benefit from this, then share the knowledge and share the video. Look forward to hearing from you soon. All the best.